As of Saturday, Taiwan has confirmed 53 cases of the novel coronavirus, COVID-19, with 1 death, much lower than the numbers reported in many other countries around the world, which have seen hundreds or thousands of cases. The low number of cases comes despite Taiwan being so close to mainland China, the origin of the outbreak, and having extensive cross-strait exchanges, including many Taiwanese people and Chinese tourists coming here during the Lunar New Year holiday in January, when the disease was spreading so rapidly in China's Wuhan city. Taiwan's Health Minister, Chen Shizhong, who is also chief of the Central Epidemic Command Center, explains at a recent CCC press conference why Taiwan has had relatively few COVID-19 cases, and what lessons countries around the world may gain from its experience as they battle this pandemic. We think the reason we have so few cases is because we acted relatively early. On December 31st, we began screening passengers arriving on flights from Wuhan. At that time, on December 17th, there were already reports of rather severely ill patients in Wuhan. And in a short time, we began screening passengers. On January 20th, we activated the Central Epidemic Command Center. Because we activated the CCC, on January 21st, when our first case returned from Wuhan and informed us that she was not feeling well, we were able to confirm it and take action. With all of the subsequent cases, once we confirmed them, we were able to take similar action. So our actions were relatively quick. All of us can imagine if we had reacted even a little late to the cases early on. All of us can imagine if we had acted even a little late to the cases early on, then 1 would have been passed on to 10, and 10 would have been passed on to 100. It would have been out of control. Secondly, every country bases its actions on its national situation, health situation, political system, and legal situation to adopt various epidemic prevention measures. Taiwan has earlier experience combating SARS in 2003 and the H1N1 flu pandemic in 2009. In addition, Taiwan also has a comprehensive healthcare system, with 99.9% of the population covered by the government-run national health insurance. Our medical system and medical information were also very comprehensive. Information on various matters was very advanced. Under the situation, and with the comprehensive system and information we have, we were able to relatively quickly determine the suspected and confirmed cases. But every country's laws and situation are different, so each government makes its own decisions based on its national situation. Our medical workers, including quarantine workers, are very professional, and our medical experts provided clear advice, and what we didn't know we tried to find out from passengers' travel history, and symptoms from fever to respiratory problems from people suffering pneumonia. Gradually, we expanded the scope of screenings by checking people with no travel history, but who were suffering from pneumonia at hospitals. We tested 113 patients at one hospital, 112 tested negative, 1 tested positive. That was our 19th confirmed case, who later died of the virus. The expansion of screening has so far helped prevent a large-scale community The expansion of screening has so far helped prevent large-scale community-level outbreaks in the country, which would cause a bigger impact. In the subsequent cases, we also adopted the same method of proactively screening patients with serious symptoms, as well as the people they had close contact with, such as their family members. We actively find them. Later, we carried out tests in the community. So first, we had a relatively high level of alert. Second, we had experience from 2003. Also, medical expertise, transparent information, and our health insurance system enabled Taiwan to basically be stable in this epidemic so far. In the future, we'll face big challenges, so we must continue to work hard. So first, we had a relatively high level of alert. Second, we had experience from 2003. We also had medical expertise, transparent information, and our health insurance system, which enabled Taiwan to basically be stable in this epidemic so far. In the future, we'll face big challenges, so we must continue to work hard.